You're looking to get the real story, the key details, without drowning in jargon. We get it.
Yeah, absolutely.
And that's exactly what we're doing today. We're taking a deep dive into something that affects so many of our feline companions and can be, well, a real puzzle. Feline Idiopathic, lower urinary tract disease, or ILUTD. It's kind of a medical mystery in the cat world, and we're here to investigate.
That's right. And you might have heard older terms, maybe like feline urologic syndrome or FUS.
Right, FUS, I remember that.
But the reason we've moved on from those is, well, they were basically umbrella terms for a set of signs.
What kind of signs?
Things like blood in the urine, difficulty, or maybe pain when a cat urinates, going to the litter box constantly, or, accidents outside of it.
Okay.
The really crucial point is that those signs could be triggered by a whole range of different underlying problems.
Exactly. So our mission today, as we've sifted through the veterinary literature, is to really unpack what ILUTD actually is.
Yeah, get to the bottom of it.
Think of this as your shortcut to understanding this often frustrating condition. And the absolute key to remember right from the start is that ILUTD is what's known as an exclusionary diagnosis.
Precisely. And that just means we only arrive at an ILUTD diagnosis after we have systematically ruled out all other identifiable causes for those lower urinary tract signs.
Right.
So maybe we should start with, what are these clinical signs that might make an owner suspect something's wrong in the first place?
Okay, yeah. The ones you're most likely to notice are hematuria. That's if you see blood in the urine. Then there's dysuria, which is when your cat seems to be having trouble or is in pain while urinating. Straining, maybe?
Yeah, straining is a big one.
You might also see pollakiuria, which is when they're making very frequent trips to the litter box, often without producing much.
In and out, in and out.
And then periuria is when they start going in places other than their litter box, inappropriate urination.
A very common complaint.
And in some more serious situations, there can even be a complete blockage of the urethra, a urethral obstruction.
Which is a true emergency. And it's important to keep in mind that these signs are the urinary tract's way of signaling something isn't right, but it's a fairly limited set of responses,
Right. The body only has so many ways to show distress.
Exactly. It makes pinpointing the exact cause so challenging. You'll often hear the terms ILUTD and Feline Idiopathic Cystitis, or FIC, used almost interchangeably.
FIC, okay.
They both basically refer to this diagnosis we reach when we've eliminated all the known culprits. The idiopathic part means we don't know the specific cause.
Right. So we know what we might see from the outside, but what's actually going on inside the cat? What's the underlying mechanism that leads to these signs?
Okay, this is where it gets really interesting, and also where that idiopathic part really comes in. Because as the literature clearly states, the precise cause, the idiopathogenesis of ILUTD is still uncertain.
Still uncertain. Okay.
But researchers are exploring several pretty compelling possibilities.
Okay, let's dive into those. What are the main ideas being investigated?
Well, one prominent theory centers around a dysfunction of the urothelial barrier.
A urothelial barrier.
Yeah, that's the protective lining of the urinary tract. If this barrier is weakened or damaged somehow, it could lead to inflammation and irritation.
Makes sense. Like a leak in the defenses.
Sort of, yeah. Another idea is neurogenic cystitis.
Neurogenic, involving nerves.
Exactly. It suggests that problems with the nerves controlling the bladder might be playing a significant role in how it functions. Think of it like the communication system to the bladder is a bit off.
Nerves affecting the bladder, that makes sense when you consider how intricate the body is. What else are they looking at?
There's also the concept of a mast cell-induced neuroimmune interaction.
Okay, that sounds complex.
It is. Mast cells are immune cells that can release substances causing inflammation. Researchers are exploring how they might be interacting with the nervous system within the bladder itself.
Wow.
And finally, there's the idea of systemic psychoneuroendocrine dysfunction.
Psychoneuroendocrine. That's a mouthful.
Yeah. In simpler terms, it points to a complex interplay between the cat's psychological state, the nervous system, and hormones throughout the body.
So it's not just about the bladder itself, it's like the whole system reacting.
Exactly, the whole interconnected system.
Wow, okay. That's a lot of potential factors. The sources we looked at also mentioned a possible link with viruses, specifically caliciviruses.
Yes, that's a really intriguing area. It's still being researched quite a bit. Both experimental studies and observations in clinics have suggested that caliciviruses might be involved in some instances of ILUTD.
So maybe not always, but sometimes.
Potentially.
Yes.
the exact nature of their role is still being uncovered. It's not saying ILUTD is always a viral infection, but it could be a contributing factor in certain cats.
Interesting. And there was a comparison drawn to a condition in humans.
Absolutely. The literature highlights some interesting similarities between ILCT in cats and interstitial cystitis in humans.
Interstitial cystitis, okay.
Both conditions can involve lower levels of certain protective substances in the urine, these things called glycosaminoglycans, or GAGs.
The gag.
Yeah, GAGs. And also an increased permeability or leakiness of the bladder lining.
Ah, like we mentioned with the barrier dysfunction.
Exactly. This has led to the hypothesis that there might be a similar underlying neuroinflammatory process happening in both cats and humans with these conditions.
So it's much more than just a simple bladder issue. It could involve the nervous system, inflammation, really complex stuff.
Definitely seems that way.
And what about stress? We all know cats can be quite sensitive creatures. How does stress fit into this picture?
Well, the clinical observation is definitely there. Vets see it all the time. Stress seems to play a pretty significant role in triggering or worsening the signs of ILUTD.
Triggering or worsening, okay.
But the current understanding, based on the evidence so far, is that stress is probably unlikely to be the primary underlying cause in most cases.
Ah, okay. So it's more like a contributing factor, something that pushes a vulnerable cat over the edge.
That's a good way to put it. It likely exacerbates a pre-existing vulnerability.
Okay, that's an important distinction. So who typically gets ILUTD? Which cats are most affected, and how common is it really?
So ILUTD specifically affects the lower urinary tract, that's the bladder, and the urethra.
Got it.
And like we mentioned, in those severe cases where urethral obstruction persists, it can unfortunately lead to post-renal azotemia.
Which is kidney problems, right? Because the urine backs up.
Exactly. Serious kidney issues due to the backup. Now, when we look at the numbers, the incidence of cats showing those hallmark signs, blood in urine, difficulty urinating, or obstruction, is estimated to be around 0.5 to 1% of domestic cats in the U.S. and Great Britain each year.
0.5 to 1% per year. That actually sounds like quite a few cats when you think about the total cat population.
It really is. And when you focus specifically on cats that are brought into veterinary hospitals because of lower urinary tract issues, ILUTD accounts for a very significant chunk, about 65% of those cases.
65%? Wow.
Yeah, it's the most common reason for those signs. Regarding age, it's most commonly seen in young to middle-aged adult cats. The average age is around 3.5 years old.
3.5 years. Prime of life, really.
Exactly. It's less frequently diagnosed in cats younger than 1 year or older than 10. So it seems to be something that often hits cats right in their prime adult years.
Okay, so typically those prime of life kitties, what are the specific things an owner might observe, the history they'd report, that would make them think their cat might have ILUTD?
Well, the historical findings that owners report are precisely those clinical signs we talked about earlier.
Right, the hematuria, dysuria.
Exactly. Dysuria, so straining or discomfort when they try to urinate. Hematuria, if they see visible blood. Pollakiuria, that increased frequency.
Going all the time.
And periuria, which is urinating outside the litter box. Owners might also notice behaviors that suggest their cat is struggling with an outflow obstruction, like repeatedly going to the box but not actually passing any urine.
That sounds distressing just to watch.
It really is.
Yeah.
And if an owner brings their cat to the vet with these signs, what might the vet find during a physical exam?
What would they feel, perhaps?
A common finding during the physical exam, when they palpate the abdomen, is a bladder wall that feels thickened, firm, and maybe contracted, smaller than expected.
Thickened and firm. Okay, so we've covered what it looks like and who's at higher risk. Let's dig a little deeper into the potential causes and those risk factors again. We've touched on the uncertain primary cause.
Right, the idiopathic part.
But the sources mention non-infectious factors being key, and that possible role of viruses again.
That's correct. The primary underlying factors are definitely considered non-infectious, with idiopathic cystitis itself being the main category we land in after ruling other things out.
Okay.
And as we discussed, viruses, particularly caliciviruses, are still being actively investigated for their potential contribution. Not proven, but suspected in some cases.
And stress keeps popping up as a really significant risk factor.
Yes, stress is definitely considered a significant risk factor. It can trigger episodes or make existing signs worse.
But again, probably not the root cause for most.
Exactly. It's really important to remember that distinction. It's not believed to be the main underlying cause of ILUTD in the majority of cases, just a major contributing factor or trigger.
Right. Okay, so if a cat presents with these concerning signs, what other conditions does the vet need to rule out before landing on that ILUTD diagnosis? What's involved in that differential diagnosis process?
This is a really crucial step because those clinical signs, as we said, aren't specific just to ILUTD.
Lots of things can cause them.
Exactly. So there's a fairly comprehensive list of other possibilities that need to be carefully considered and eliminated.
Like what?
Well, this includes metabolic disorders, probably the most common being the formation of uroliths or bladder stones.
Stones, okay.
And also urethral plugs, which are these accumulations of minerals, mucus, cells, other substances that can actually block the urethra, especially in male cats.
Right, the plugs are a big issue for males.
Definitely. Then we also have to think about infectious agents.
Infections, like a UTI.
Could be. Bacteria are the most common thought, but it could also be things like mycoplasma, ureaplasma, sometimes even fungi, or very rarely, parasites.
That's quite a range of potential infections.
It is, which is why thorough testing like urine cultures is so important.
Yeah.
Then we also need to consider trauma.
Trauma, like an injury.
Yeah, maybe an accident causing bladder injury. Also neurogenic disorders that affect how the bladder functions, problems with nerve control.
We mentioned nerves earlier.
Right. And iatrogenic diseases, these are problems caused by medical procedures themselves, maybe issues related to urinary catheters, for example.
Ah.
Anatomic abnormalities the cat might have been born with, like urachal anomalies or urethral strictures, need to be considered.
Strictures like narrowings.
Exactly.
Yeah.
As well as neoplasia, which means tumors could be benign or malignant cancer.
Tumors, too. Wow.
And interestingly, this source even points out that sometimes the signs of ILUTD, like straining, can be mistaken for constipation.
Constipation. Okay. I can see how straining might look similar. That's a pretty expensive checklist of possibilities.
It really is.
So how do veterinarians actually go about ruling all of those things out? What kind of information do lab tests and imaging provide?
Okay, so laboratory tests are fundamental, particularly a complete blood count, CBC, a biochemistry profile, and a urinalysis. These give a lot of valuable information.
What do they typically show in ILUTD?
In typical ILUTD cases, you'll often see hematuria of the blood and proteinuria, which is protein in the urine. But usually without significant periuria, that's pus or white blood cells, or significant bacteria, which is bacteria in the urine sample.
So blood and protein, but not usually signs of active infection.
Generally, yes. However, if a urethral obstruction has been going on for a while,
If the cat's been blocked.
right, then the blood work might start to show signs of kidney problems that azotemia we mentioned, plus maybe increased levels of phosphate and potassium, and a decrease in the total carbon dioxide, indicating metabolic acidosis.
Okay, so the blood work changes if there's blockage and kidney impact.
Definitely. And what about specifically checking for a bacterial infection, like a standard UTI?
How do you confirm or rule that out?
A quantitative urine culture is absolutely essential for that. It tells us if bacteria are present and in what numbers. And it's really important that this urine sample is collected via cysticentesis.
Cysticentesis. That's the needle directly into the bladder, right?
Exactly. It's a sterile procedure to get urine directly from the bladder. This avoids contamination from bacteria that normally live in the lower urinary tract or on the skin. Gives us a much cleaner, more reliable picture of what's happening inside the bladder itself.
Makes perfect sense. You need a clean sample to know for sure. The source also mentioned occasionally finding calicivirus particles in those urethral plugs. That seems very specific.
Yes, it's quite specialized. Using a technique called transmission electron microscopy, researchers have sometimes identified these calicivirus-like particles within urethral plugs. It doesn't prove cause and effect, but it provides further support for the idea that these viruses might play a role, maybe contributing to the inflammation or the plug formation in certain cases.
Fascinating. And what kind of information can imaging techniques provide? X-rays, ultrasound?
Imaging is super helpful for ruling out structural issues or things like stones and plugs. Survey radiography, just regular X-rays, can often detect uroliths or plugs if they're radiopaque.
Meaning they show up well on X-ray.
Right, but not all stones do. So contrast urography, where a special dye is used, can help visualize the urethra and bladder more clearly.
What can that show?
It can help identify things like urethral strictures, those narrowings or diverticula, which are like little outpouchings, or even growths like neoplasia.
Okay.
Double contrast cystography uses both air and a liquid contrast material. They can be useful for finding smaller stones that might not be obvious on regular x-rays, sometimes called radiolucent stones, and also things like blood clots or general thickening of the bladder wall.
So different contrast methods for different potential issues.
Exactly. And ultrasonography is another really valuable tool, especially good for detecting uroliths within the bladder itself. It uses sound waves.
Ultrasound, okay. So it sounds like a combination of thorough lab work and maybe one or more of these imaging techniques helps build the picture and rule out those other possibilities.
That's the goal, yes, piece by piece.
Are there any more invasive diagnostic procedures that might be considered sometimes?
Well, cystoscopy is an option in some cases.
Cystoscopy, what's that?
That's where a small camera on a flexible or rigid scope is inserted into the bladder, usually up the urethra. It allows the vet to directly visualize the bladder lining.
See inside directly.
Right. It can help rule out subtle uroliths, diverticula, or other lesions. Biopsies of the bladder lining can also be taken during cystoscopy to further characterize any abnormal areas that are seen.
Biopsies. Would they do that often?
Not typically needed for a routine diagnosis of ILUD, usually only if something looks particularly unusual or if they suspect neoplasia, for example.
Okay, so mainly if other things aren't adding up or look suspicious. So let's say we've gone through the process, ruled out stones, infections, tumors, all that stuff, maybe even had a look inside with a scope. What might be happening on a cellular level in a cat with ILUTD? What might a pathologist see if they examined that bladder tissue?
Okay, so during that cystoscopy, the vet might observe small red spots or pinpoint hemorrhages on the bladder lining. These are sometimes called glomerulations.
Glomerulations, little bleeding spots.
Kind of, yeah. Petechial hemorrhages. Now, if tissue samples biopsies are examined under a microscope, the potential findings could include things like mucosal ulceration.
Ulcers on the lining.
Yes. Also congestion, like increased blood flow.
Yeah.
Submucosal edema, which is swelling in the layer beneath the lining. Hemorrhage, more bleeding, and even some fibrosis, which is like scar tissue forming.
Scarring. So there's definite damage happening.
There can be, yes. But interestingly, significant numbers of inflammatory cells like neutrophils or lymphocytes might not actually be very prominent.
Really? Less inflammation than you'd expect.
Sometimes, yes. Unless there's a secondary bacterial infection present, perhaps introduced by something like catheterization during treatment for a blockage.
So it's not necessarily a condition driven purely by widespread, classic inflammation like you see with an infection.
That's a really key point, actually. While inflammation is certainly involved in the process, the initial trigger, or the main driver, seems to be more complex than just a simple inflammatory response. It might involve those issues with the nervous system, the bladder's protective barrier, maybe those neuroimmune interactions we discussed earlier.
Okay, that fits with the idea of it being neurogenic or related to barrier dysfunction. All right, let's move on to the really crucial question for owners. How is ILUTD actually managed and treated in cats?
Right, what can be done? Well, the approach really depends heavily on whether the cat is experiencing a urethral obstruction or not.
Blocked versus not blocked.
Exactly. If a cat is blocked, that's a medical emergency. It typically requires immediate hospitalization to relieve the obstruction, usually with a catheter, and stabilize the cat, dealing with any kidney issues or electrolyte imbalances.
Okay, blockage equals emergency hospital visit. What about the non-obstructed cases?
For cats that are not blocked, management often takes place on an outpatient basis, though some initial diagnostic tests might still require a short stay in the hospital or clinic.
Makes sense. What about the role of diet? We often hear about special urinary diets. Are they helpful for ILUTD?
Dietary management is frequently recommended, yeah.
Mm-hmm.
Especially maybe for cats that have persistent crystals in their urine, even if they don't have actual stones.
So managing crystals.
Right. And there's also some evidence suggesting that feeding moist food like canned or pouch food rather than dry kibble can help minimize the recurrence of signs in some cats.
Why moist food?
The main goal there is to increase the cat's overall water intake, which leads to more dilute urine and increased urine volume. This helps flush out potential irritants and dilute the substances that might contribute to forming crystals, plugs, or stones.
More water, more dilute urine. Got it. And what's the owner's role in managing this day-to-day? What do they need to know?
Client education is absolutely vital here. Owners need to understand that while the initial signs often resolve on their own, sometimes fairly quickly, maybe within 4 to 7 days.
Oh, they can resolve on their own.
Often, yes, the acute episode. But recurrence is quite common and can be really unpredictable.
So it comes back.
Frequently. Owners also need to be aware that for many of the medications sometimes used to treat the symptoms, there actually isn't strong scientific evidence from well-controlled studies to definitively prove they work for ILUTD.
So some treatments might be more trial and error?
A lot of it is symptomatic or empirical, yes. And it's also crucial, absolutely crucial, to educate owners of male cats specifically about recognizing the signs of urethral obstruction. They need to know that's a life-threatening emergency requiring immediate vet attention.
Right. Knowing what a blockage looks like is key for male cat owners. And I know we touched on it earlier, but what specific steps can owners take to help manage that stress component in their cats with ILUTD?
Yeah, this is huge. Environmental enrichment for indoor cats is really considered a cornerstone of long-term management for ILUTD.
Environmental enrichment. What does that involve practically?
It involves making sure they have all the necessary resources readily available and appealing. Things like enough food and water bowls, ideally separated, plenty of clean litter boxes in quiet locations.
The rule of thumb is 1 box per cat plus 1 extra, right?
That's the common recommendation, yes. Also, enough space to roam and explore, opportunities for play and mental stimulation, puzzle feeders, interactive toys.
Keep their minds busy.
Exactly. It's also really important to ensure they have safe, quiet hiding places where they can retreat if they feel stressed or overwhelmed. Refining how owners interact with their cats to minimize potential anxiety.
Like not forcing interaction.
Right, letting the cat initiate sometimes. Carefully managing any potential conflicts between multiple cats in the household is huge too.
Cat politics.
Oh yeah. And maintaining a very consistent and clean litter box routine. Basically, creating a predictable, resource-rich, and safe environment is key to reducing stress.
That makes perfect sense. Aiming for a calm, predictable, engaging home life. Are there any surgical interventions that are typically used for ILUTD itself?
Generally speaking, cystotomy, which is surgically opening the bladder maybe to flush it out or remove debris, is not recommended as a routine treatment for ILUTD itself.
Okay, so not usually opening the bladder.
No, and similarly, perineal urethrostomies, often called a PU surgery.
The PU surgery, yeah.
That's a procedure to surgically widen the urethral opening, usually done in males with recurrent obstructions. It should generally not be performed just to prevent potential future obstruction, unless the obstruction has been specifically and clearly localized to the penile part of the urethra using contrast imaging techniques.
So it's reserved for very specific, proven cases of blockage at the end of the urethra.
Ideally, yes. It's a salvage procedure, not a preventative one for uncomplicated ILUTD.
Okay. So surgery isn't a go-to treatment for most cases. What about medications then? Our source listed quite a few that are sometimes used, but you mentioned the evidence might be lacking.
Exactly. There are several medications that vets might use empirically, meaning based on experience or observation rather than strong trial data, to try and manage the symptoms. But it's really important to understand that for many of these robust controlled studies demonstrating safety and effectiveness specifically for ILUTD are lacking.
Okay, so what are some examples?
Well, for instance, tolterodine is sometimes used. It's an anticholinergic and antispasmodic med, the idea being to reduce bladder hyperactivity or spasms. But the evidence for ILUTD isn't strong. Amitriptyline, that's a tricyclic antidepressant with various effects, is sometimes used for cats with severe or very frequently recurring episodes. But again, it's generally not recommended for acute, self-limiting cases and has potential side effects.
Okay. And what about pain relief? These cats seem like they'd be uncomfortable.
Absolutely. Analgesics or pain medications like butorphanol, buprenorphine, or fentanyl might be used for short-term pain relief during an acute flare-up.
But again, not necessarily proven effective long-term for the condition itself.
We don't have strong controlled studies specifically for their use in resolving ILUTD, just for managing the pain symptomatically. Then there are meds like phenoxybenzamine and prazosin.
What do they do?
They're alpha blockers, sometimes used to try and relax the urethra, minimize spasms, or help with what's called functional obstruction, where there's no physical blockage, but the urethra isn't relaxing properly to let urine out. Again, evidence is mixed.
Okay. The source also mentions some supplements, things to support the bladder lining.
Yes, you might hear about substances like pentosan polysulfate sodium, or PPS, and oral glucosamine or chondroitin sulfate.
Right, glucosamine, like for joints.
Similar idea, yeah.
Yeah.
The theory is they might help repair or support that glycosaminoglycan JAG layer of the bladder lining we talked about.
Do they work?
Well, unfortunately, well-controlled clinical studies have not consistently shown a significant benefit from these supplements in reducing the severity or frequency of ILUTD signs in cats. Some vets use them, some don't. The evidence isn't really there yet.
So more uncertain benefits. Are there any medications that have definitely been shown to be ineffective for ILUTD?
The literature we reviewed indicates that corticosteroids, like prednisone, also non-steroidal anti-inflammatory drugs, NSAIDs, DMSO, which is sometimes used for inflammation, and antibiotics, or the urinary antiseptic methenamine. None of these have shown a detectable effect on the actual remission of ILUTD signs when studied. Doesn't mean they aren't used for other reasons sometimes, but not for treating the underlying ILUTD.
Okay, good to know what doesn't seem to help the ILUTD itself. And crucially, are there any medications that should be absolutely avoided in cats with urinary issues or ILUTD?
Yes, definitely. There are some important contraindications. Phenoxyperidine is the urinary tract analgesic, sometimes used in humans, turns urine orange.
Right.
It can be toxic to cats. Should not be used. Methylene blue, a weak antiseptic, can also cause serious problems like Heinz body anemia in cats. Also avoided.
Okay, toxic. Good to know.
And beef. This is a drug sometimes used to help stimulate bladder contraction, maybe in cases of a weak or hypotonic bladder after an obstruction is relieved. But it should absolutely never be used if there's any chance of a current urethral obstruction, because forcing the bladder to contract against a blockage is dangerous.
Wow, okay. Those are really important warnings. What about potential complications that might arise from the treatment itself? Any precautions?
Yes, that's important too. It's crucial to be aware that cats who have a urethral obstruction and also have concurrent kidney issues, that azotemia,
Right, the kidney involvement.
they are at a higher risk for experiencing adverse drug events or side effects from medications because their ability to process drugs might be compromised.
Makes sense. Kidneys filter waste.
Exactly. Also, the use of indwelling urinary catheters, while often necessary to relieve a blockage, unfortunately does increase the risk of the cat developing a secondary bacterial urinary tract infection.
Catheters can introduce bacteria.
It's a known risk, yes. Needs careful management.
Okay. So, after diagnosis and initial treatment, what can owners typically expect in terms of follow-up care and the long-term prognosis for a cat diagnosed with ILUTD?
Well, monitoring for recurrence of hematuria, the blood and urine, often through follow-up urinalysis, is commonly recommended. And ideally, it's best to collect a free catch urine sample if possible for those follow-ups,
Why free catch?
to avoid causing any artificial bleeding just from the cystocentesis procedure itself, which can happen sometimes and confuse the picture.
Ah, iatrogenic hematuria. Got it.
Right. The preventative measures we've discussed, primarily feeding moist food and consistently working to reduce environmental stress through enrichment, these are really the key pillars for long-term management.
Diet and environment.
Exactly. Potential complications that can sometimes occur besides recurrence include trauma and infection related to those urinary catheters we mentioned, and potential infection or stricture formation following a perineal urethrostomy if that surgery has been performed.
So even the treatments have potential downsides.
They can, yes. Now, the typical course of ILUTD, as we said, is that the initial signs often resolve within about 4 to 7 days, sometimes even without specific treatment.
Okay.
But, and we have to keep emphasizing this, recurrence is quite common and can be unpredictable, though there's some suggestion that the frequency of episodes might decrease as the cat gets older.
Might get better with age, maybe?
Possibly, in some cats.
Right.
But certainly not a guarantee.
Okay. So to kind of bring it all together then, ILUTD is this really complex condition in our feline friends where the exact underlying cause remains a bit of a puzzle.
Still idiopathic, yeah.
But it seems pretty clear that stress plays a significant role, at least in triggering those episodes.
Definitely a major factor.
Getting to a diagnosis involves carefully ruling out a whole range of other possibilities: stones, infections, tumors, you name it.
The whole differential list, yeah.
And while the immediate signs often improve on their own, maybe in about a week, it's a condition that unfortunately has a tendency to come back.
Recurrence is the name of the game, sadly.
Exactly, and the main focus of management really centers on things the owner can control, creating a more stable, less stressful environment for the cat, and potentially making changes to their diet, especially increasing moisture.
Those are the cornerstones, absolutely.
And while there are various medications that veterinarians might try, particularly for pain or spasms, the strong scientific evidence specifically supporting their effectiveness for resolving ILUTD itself is often, well, lacking.
Yeah, more research is definitely needed on the treatment front.
This has been a really insightful deep dive into ILUTD. It really highlights just how much we're still learning about this very common and often very frustrating feline health issue.
It really does.
And it really makes you think, doesn't it? Given this clear connection to stress and those fascinating parallels with human interstitial cystitis, what could future research into the cat's neuroendocrine system, the stress response system, and the impact of environmental factors, what could that reveal about how to better manage ILUTD down the line? What if the real key to long-term feline urinary health lies not just in treating the symptoms as they pop up, but in gaining a much deeper understanding of their behavioral and their emotional well-being?
That's a really interesting thought, a more holistic view.
Yeah, it certainly gives you a lot to ponder.